My name is Trish Livingston. I'm the Director of Claims Operations here at the Workers' Compensation Board, and I'm pleased today to provide some information on how to manage a WCB claim and some highlights from our business transformation efforts. When an injury occurs at work, it's important that the worker get medical attention immediately if required. When seeking medical attention, it's important to advise the healthcare provider that the injury occurred at work so that a report can be submitted to the WCB. It is also the worker's responsibility to report the injury to the employer so that the employer can make the necessary report to the WCB. And lastly, it's important to report the injury to WCB. All reports can be done by phone, fax, or online. A benefit of having a WCB online account is that you can report and submit claim-related information, including all forms, through your WCB online account and be able to access copies of what you submitted. The sooner the information that is received at the WCB, the sooner we can begin the steps in the WCB process. Next slide. The steps in the WCB process are to first report the injury and submit the information to WCB from the worker, employer, and care provider. At that point, WCB will do an assessment to determine if it is a work-related injury. If the claim is allowed, WCB will begin recovery and return to work planning with the worker, employer, and care providers on the team. And finally, WCB and the employer will provide benefits to that worker. One of the first steps to ensure that all relevant information is submitted to the WCB. The more information that can be provided at the time of the notification of the injury, the sooner we can begin to facilitate recovery or return to work. Details about the nature of the injury and where medical attention was sought are important. If you have questions about the process, contact us. We have staff here willing to assist you through the process. Making a decision on a claim can sometimes be complex. There are numerous policies which must be considered. We are a no-fault system that manages over 25,000 claims annually. 8,000 of these claims are time loss claims, and 3,500 are considered long-term claims. About 2,000 claims turn into claims that are over 1 year in duration. Recovery and return to work planning is a collaborative effort among the worker, employer, care provider, and WCB. WCB acts as a facilitator of the recovery or return to work program. It's the responsibility of the worker and the employer to participate in finding accommodated duties if possible. Later on, we'll talk about preventing work disability, but at this point, I'd like to mention that the longer a worker is unable to work, the greater the chances the claim will turn into a long-term claim. So it's important to get the information to us as soon as possible. WCB administers benefits. We issue more than earnings loss benefits depending on the medical and vocational needs of the customer. For example, WCB may cover medical treatments, prescription drugs, medical supplies, travel costs, or personal care allowances. The worker may remain on the payroll, but WCB will reimburse the employer for any lost time. If you have any questions about our policies, you can visit our updated website, which has all of our policies in an easy-to-find format. WCB also provides specialized services to handle the most complex cases that Annette's already talked about. In 2017, WCB established an extended service unit to provide specialized services for cancer claims, fatalities, and catastrophic injuries. In 2020, WCB fully launched a psychological injuries unit to better serve workers with psychological health claims. WCB has also established a partnership with WorkSafe Saskatchewan and Dr. Samra, as Annette has already mentioned earlier in her presentation. And as part of this partnership, as she has talked about, we've created a long-term strategy to assist employers with dealing with psychological health issues in the workplace that focuses on awareness, education, training, partnerships, and inspections. The WCB has been working to support the unique challenges of workers with psychological injuries and has seen a decline in durations of these claims in the past 5 years, from an average of 78 days in 2017 to 61 days in 2021. This chart also compares psychological injury durations to the durations for overall claims, which were 40 days in 2021. WCB continues to focus on supports for psychological injuries and respond to the unique challenges of workers and employers dealing with these types of injuries. At this point, I'm going to hand the presentation over to Marcy Hay-Dimitro. Marcy is our business lead for the Claims Transformation Project at WCB. Marcy will be providing some information on our recent transformation efforts in claims as part of the Business Transformation Project at WCB. Marcy, over to you.
Trish. As Trish said, my name is Marcy Dimitro. I'm the Claims Transformation Business Project Lead, and I'm happy to be able to share with you what's happening at WCB to transform the way we're serving our customers. Why change? There's three main reasons for changing the way we provide service. Customers have told us that our processes and services don't meet their needs and expectations, and we know we need to do better to provide more timely service. It's easy to navigate and helps them to get on the road to recovery quickly. Staff have identified how we currently work is not always effective. They are also frustrated by the inefficient processes and technology systems. And third, our services don't consistently incorporate known best practices to prevent work disability. Next. Throughout our transformation journey, we're engaging customers, workers with claims, employers, and our stakeholders, and even our own employees to help us redesign our processes and services. Our customers are the ones with the knowledge of our problems and the best ideas for solutions as well. As we aim to make our services more customer-centered, we want their feedback and input into what works best for them. Next. In 2021, WCB developed a set of attributes which acts as guiding principles to design our future state and guide our transformation efforts. I'll go through them somewhat quickly. Number one, building trusting, respectful, two-way relationships with our customers and each other. We recognize that empathetic and respectful relationships are key to the success of our future vision, both with our customers and with our colleagues. Number two, ensuring each claim represents a unique individual and not just a number. Our customers have told us they need to feel like a person, be treated like a person, and not just a claim number. Number three, getting it right the first time, getting the right information to the right person at the right time. A lot of rights in there, but building on the quality that needs to be built into the overall design of our future state. Number four, reducing the length of time our customers are waiting. We know timeliness is key to ensuring we can provide the supports needed when our customers need it. We'll eliminate wait times whenever we can. An example of this would be auto adjudication of claims, where we would leverage new technology to adjudicate straightforward claims and kind of kick out those that don't fall within established rules and then route them for manual adjudication. This means that staff can spend their time where it's most needed with the customers that require the most support. Number five, minimizing handoffs are within our system and ensuring that any handoffs we have are adding value to the customer experience. We will minimize handoffs within the system, limiting it to those that are required and or adding value to the customer experience. This means that how people will do their work might look slightly differently, although we haven't determined exactly what that means yet. We've heard from workers with psychological injuries that telling their story multiple times can be difficult. We'll be looking to explore options to move towards single point of contact whenever we can, where someone takes a claim from injury to recovery. Number six, serving customers the way they want and need to be served. So meeting our customers where they are in their WCB journey and keeping up with their expectations in terms of service. Looking towards things such as secure electronic information exchange, a wonderful app they can access on their phone, lots of great things in our future. Maximizing the ability of employers and workers to self-serve on things like their claim status. So leveraging technology to help customers self-serve. We want to make it easy for customers to find the information they need when they need it, while still providing the option of contacting us for support. And number eight, communicating proactively with our customers, being one step ahead of the customer and proactively reaching out at the onset of a claim and throughout the management of the claim, providing clarity and support. We picture the customers not feeling like they need to reach out and call us looking for information because they know everything they need to know and are confident with the next steps due to the proactive communication. Next. So within the claims transformation program, some of the initiatives have included thus far segmenting claims. So grouping and assigning claims differently based on defined categories and risk factors, ensuring those claims get to the right person at the right time to provide unique and appropriate support for those specific customers. Another piece we worked on was quicker adjudication. I referred to it a slide back, an example being auto adjudication with the appropriate technology solution to support that. In today's world, looking at using decision models on straightforward claims to improve the time to decision and getting that claim where it needs to be. We've also looked at enhanced proactive communication, improving our communication methods and standards for all customers, our workers, and our employers. Clear collaborative communication is key. I think everyone can agree with that. Streamlining forms and other processes have been looked at as well. So looking to remove confusing forms and processes, adding ease to the processes, adding clarity and value to the customer experience. And customer-centered work disability prevention and mitigation. So looking to using a worker-centric approach, keeping our customers at the center of every interaction in order to achieve improved return to work outcomes, focusing on improving our processes and services to align with best practices in work disability prevention. Next. Just a quick highlight for you on training available for work disability prevention. The Government of Canada is providing some funding to the National Institute of Disability Management and Research, known as NIDMAR, to support professional development in disability management. There are 4 options for all Canadian residents: continuing education, professional disability management designations, support for workplaces for assessment of their workplace disability management programs, as well as scholarship opportunities for the Bachelor of Disability Management program. So all excellent professional development opportunities to support prevention of disability in your workplaces.